was a great start to the event. I'm Som Mittal. But what better than to have our own Dr. R.S. Sharma, CEO of the Ayushman Bharat Digital Health Mission, and also the head of the Health Authority with us. He leads one of the most ambitious projects, and this would help integrate healthcare sector with citizens. I don't want to spend time introducing Dr. Sharma because he has a great reputation, and his biggest reputation from my perspective is that he is one of the foremost executors I've seen at scale. He was behind Aadhaar. He was the key mover for COVID. He helped out in this mission, and now this is Ayushman Bharat has always been present as the inaugural speaker with us here. And each time, Dr. Sharma, we are very impressed as to how you show us that you have made quantum jumps compared to where you were last year. So with that, Dr. Sharma, welcome. And we are looking forward to hearing from you what you're doing, and also your message to all the healthcare providers of what we need to do. Over to you, sir.
Well, thank you very much, Som Mittal ji, and good afternoon to you all, friends here, Rajkumar Patil ji, Vijay Agrawal ji, and others whom I see on the screen. First of all, I'd like to thank the CAHOTECH 2022 team for inviting me for this session on public health, making it reality with technology. And I think both Sri Vijay Agrawal ji and also Som Mittal ji, both of you have and to how technology can become an enabler in actually what you rightly described as a quantum jump or a qualitative, leapfrogging into the area of healthcare. Technology, as you are all know, and you have been a veteran of technology since last so many years, and I have known you since many decades. Technology has been one of the great transformational impacts on our civilization since last couple of decades, particularly so. And now we are talking of, as Vijay Agrawal said, the industry 1.0, 2.0, and now we are talking of industry 4.0, where the devices are controlled by sensors and by technology, and they work in an automated manner and create products and services. So I think this is really a very exciting age in which we are living. And I think, as rightly pointed out, COVID had a disastrous impact on the entire world. The whole world stopped, and we really were all, really very, very desperate and depressed in the whole time of 2 years, around 2 years. But one particularly good aspect of COVID has been the use of technology in healthcare seeking behaviors and in many other areas, because we were not allowed to go out. So therefore, we were constrained to use video consultations, video calls with our doctors, and talking to people. So that has been one of the good parts, if you can think of it as something good out of COVID. That has been one good aspect of it. And of course, couple it with the fact that India has been very, very fortunate and lucky now. We are very lucky that the entire country is covered with 4G technology, and we are actively talking about 5G, which is again going to have and provide another quantum jump movement for us. But 4G connectivity with extremely low data rates and video calls and other things has really made it possible for everybody. It's very inclusive digital connectivity infrastructure which we have created in this country. Even poor laborers working in Delhi and working other places, they also are able to talk in the evening with their family on video calls. So that is actually something great which has happened in our country. And this is a part of our Prime Minister's Digital India initiative. If you recollect, in 2014, we went with Digital India. The Honorable Prime Minister launched that project. And 3 areas which were there in that project were, one was the digital connectivity as a utility to citizens. So digital connectivity has really been achieved. Obviously, there are a lot of things to be done in terms of 5G, in terms of fixed wireless access, and in terms of remote sensors and other kinds of things. But I think for the time being, if unless one is talking of remote surgeries and those kinds of concepts, I think for the time being, we have adequate connectivity in this country. The other thing which he talked about in Digital India was software and services on demand, which means we create softwares. And fortunately, we have created during the last decade or so a number of digital public goods which are delivering services at a very, very fast rate. So imagine digital identity which we created, and now that digital identity is providing authentication services, providing digital KYC, which is so important for accessing any formal system, is providing digital signatures on demand, providing digital locker, electronic consent. There are multiple, products which have come out of that digital identity. And this is one of the very, very robust infrastructure. We have done about 73 billion authentications over the last about 7 or 8 years. So that is, and of course, billions of electronic KYC. We have 4 billion records in the digital locker, and a tremendous amount of. If I can reel out the statistics which are impressive, and then I read out these statistics in front of other countries, of other representatives of other countries, they just are stunned. We can't believe. They say, oh, is it billion or a billion? So actually this is what we have achieved. Similarly, the unified payment interface has revolutionized the digital payment systems in this country, and there are many other things which have happened. Now, what we want to do, and CoWIN, of course, you gave the example, CoWIN has proved that we can really be extremely inclusive, extremely scalable, extremely simple. At the same time, we can have real-time transactions running into billions. There is no platform in the world which has scaled to more than 1 billion in a matter of a year. I mean, nothing, no platform comes even near this. Windows took 25 years to become 1 billion. Google took, so many years. Amazon took so many years. I mean, really, we have great speed has been achieved through these things. So what I want to say is, having proved the fact that India can create digital public goods at a scale in a very frugal way, in a very unique way. I think UPI payment systems, for example, I can transfer 1 rupee to Mr. Som Mittal and he will receive 1 rupee. Not even 1 paisa is actually deducted out of it. So this is the way we have created very, very frugal systems. And I think this is a right moment in history where we can leverage digital technologies to deliver affordable, accessible, available, and quality health services in this country. I have no doubt in my mind. And what we can achieve in this is phenomenal. So, for example, in the last 1 year or so, 1.5 years, the Honorable Prime Minister launched the National Digital Health Mission on 27th of September last year. It happened to be just 1 year. And of course, before that, we had done pilots in about 6 union territories. And what we are building now is the building blocks for making this entire journey happen of delivery of health services. So what are the essential components of that? I will just describe within the next few minutes before you, just to say that, look, everything is there. People are talking on telephone, people are doing video calls with their doctors, but all that is happening in a very fragmented way. What we want to do is essentially achieve the basic objective of not only providing digital services, health services in a cost-effective way, in a frugal way, but also create data at a massive scale, which can be used by policymakers to make appropriate policies on the basis of that data. So this is truly a data-driven policy making, as we have been doing in a multiple number of areas. So let me just say, first of all, we have created what is called digital registries. Now, these digital registries are extremely important. So we have a registry of health facilities, which essentially ensures that this is a digital public good which can be accessed by citizens, by tech providers, so that everybody is able to see an authenticated list of hospitals. So if I'm searching for a hospital, if you remember COVID, when I was searching as to where do I go for vaccination, it will show what are the hospitals available which are offering vaccination services, what kind of vaccines they are doing, how far they are from your place. It was even giving the kind of passage to route to that facility. Similar, we will have the health facility registry is being constructed, and we have more than 1 lakh health facilities are already on that registry. Second, we are creating a health professionals registry, which means the doctors and the nurses and the other kinds of health service providers, health service professionals, which are available on this network, which means I could see, okay, if I have a problem in my stomach, which is the endocrinologist I should go to, and which is the one which is near me and stuff like that, and whom I can connect. And then, of course, health professional registry also enables you to basically connect with the video consultations. So the second thing is health professional registry. Third is we are creating a drug registry. Drug registry is essentially means the entire set of drugs, both branded, everything. And therefore, one should be able to figure out, okay, these are the drugs available, this is the equivalent drug, these are the prices, and so therefore it will help consumers and also pharmacists and other kinds of ecosystem partners. So these are the registries which we have made. Now, other thing from a consumer side, we have created what is called the personal health record system. So you have PHR applications, as we call them. That application is basically able to accumulate or basically link all your digital health records, which are created or which are historical or which you have with you. You can scan them and you can store them, and therefore you will be able, the patient will be able to make a longitudinal health history, which can be used while buying an insurance or showing to a doctor. You can share that with the doctor, saying that this is my history. Every time you go to a doctor, you bring all that whole pulanda of the kind of reports, diagnostic reports, and other things that could be obviated. So that's one part. Then we have created something called health account. Our Prime Minister was very clear when he announced national health, where he said that every citizen of this country will have a health account. So we are creating a health account. Now that health account is the one which is a reference point. It's like a virtual account, virtual wallet, which you have, which is just a number, that account number. And you can, link all your health record with that number, and that you can show. We are making a digital consent, kind of artifact, which is consent manager, which means that only you can share your health record. Only you can link your health record. So everything is basically patient-centric. It is not somebody else who is taking decision on your behalf. You are the one who are the master of your own records. You are the owner of your own records. So that's another part which we have created. We have created an interoperable system, interoperable video consultation system. So you'll be happy to know today, if you have a video consultation, then the doctor and the patient have to have the same application, same app, as we call it. So whether it is 1mg or Practo or eSanjeevani, you have to have the same application, which is like you buy on Amazon. You have to have an Amazon app to do transactions on Amazon platform. Now we are actually creating an interoperable system whereby any end user application can talk to any health service provider application, which means the doctor can be on eSanjeevani and I can be on the Practo, and we could talk. So that is what we are creating, an interoperable framework based on standards and open APIs. So the overall architecture which has been created is an architecture which can ensure interoperability, which will mean that there's a framework and any application provider can create a small application and plug into this framework. So this framework is what we are creating. We are not creating applications. And that is actually what we did in Aadhaar. That's what we are doing in UPI, whereby we prescribe only the framework. Similarly, that's what we did in CoWIN. CoWIN today have got 150 partner applications which are connecting with CoWIN and providing services to their kind of customers and their clients. Similarly, what we are building is just a framework where all health tech companies, all other people will be able to build applications which will be able to connect. So this is what we have created, and we have also created a real-time framework, which is, you can see it as a dashboard like COVID. You can see the real-time vaccination progress in this country. Similarly, you can see there's a website called dashboard.abdm.gov.in, a dashboard of the ABDM, where you can see how many Aadhaar numbers, the health account numbers have been created, how many hospitals are there on HFR, how many people have downloaded the PHR, how many records have been linked. And I'll be very happy to share with you that the record linking is happening at the rate of 1 million records per day. Can you believe it? 1 million records per day. India produces 6 billion records per annum. And if everything could be, so for example, we are still at the rate of 365 million per year. Now there's a lot to go, but still you should appreciate the fact that within 1 year of its existence, ABDM has been able to scale up to that level where we are linking 1 million records per day. Thus far, we have done about 5 million records, because earlier it was only a few thousand records per day. Then we scaled up, and it's now an exponential part. So I think what is happening is, and of course, we have all the building blocks. We have Aadhaar, which actually can digitally either authenticate whether he's a real doctor or not, whether he's a real patient or not. We have UPI, where you could pay remotely. We have the digital signature on demand, which means that you can sign the prescription digitally and share that prescription. So we have all the digital, building blocks to make these transactions happen. So they are general horizontal building blocks, and now we are creating basically specific building blocks for the health space. And what I urge to your members, to everybody, and this is what I've been telling. Look, this is a project where the framework has been built out. The framework is privacy preserving. The framework is absolutely robust, scalable, inclusive. However, we need the support of all the ecosystem providers, whether they are service providers largely, the laboratories, the hospitals, the doctors, that please digitize this health space. Without digitization, things will not move. Aadhaar was a simpler project to execute. Why? Because there were only two stakeholders. One was the people who wanted digital identity, who wanted an identity. Forget whether it is digital or non-digital. They said, "Hamare paas koi provable identity nahi hai." Aadhaar provided that. And there was a government who was having money to provide that identity, to enroll people and provide the identity. Here, the health part is a little more complex. You have doctors, professionals, you have the hospitals, you have the laboratories, you have the pharmacies, and you have the patient. And everybody has to get interested in ensuring digitization. And once that happens, believe me, we can become the real leaders in the world in terms of creating this architecture, number one. And number two, it will definitely result in affordability, accessibility, availability, and quality of health services. And especially for the public health perspective, people can take decisions. The governments could take decisions based on the pattern which data indicates as, oh, this is a disease which is prevalent in this area. This particular medicine, not the private data, but an integrated data, basically an anonymized data, which is an aggregated data, which could actually become the fulcrum, which can become the basis of policy making. So I think I just want to end my interventions with the request that everybody should now start thinking in terms, because it cannot happen. NHA itself cannot do it. Government of India itself cannot do it unless we have the support of the state governments, of the hospitals, of the community, medical community at large. And we are having consultations with everybody so that this whole thing can happen at a scale. And I think we will be the one, because other countries have digitized. America has digitized, Europe has digitized, but there the digital systems are silos. Cerners and some other companies in the world, they are basically controlling the maximum amount of data, and they don't want to talk to each other because they think if I talk to other person, my customer base will go away. But interoperability is not an afterthought for us. Interoperability is the basis of our applications, and that's what we are doing. Thank you very much once again for inviting me to this conference, and I'm always excited, and you guys are doing a wonderful work. Thank you very much.
Dr. Sharma, this was really fascinating. We're going to take a few more minutes of your time here. Clearly, I think you were so articulate in terms of all the building blocks that are there. Just a question, so when do you think, in terms of timelines, while the blocks are ready, that this would actually become a national level implementation?
Well, it's already a national level implementation in some sense. Only thing is that it has to kickstart, it has to start. And that start is essentially the data. You know, it's like an empty house as of now. Data is the one which actually populates this house. The transactions will populate this house. And that, I think, is what is required. And that will require collaboration from everybody. Not really. So basically, the house is ready. The framework is ready. Now let's enrich it. Let's actually fill colors. It's like a sketch is ready. You need to fill the colors into this sketch so that the entire thing becomes a reality. And I think this could happen in a year's time. I'm very happy about it. I'm very sure that it could start getting used as a scale in a year's time. And of course, the sky is the limit. Then of course, continue, we can continue. And what can happen, for example, we are starting a small experiment. People are, falling in lines. In AIMS, if you see people come in the line at 4 a.m. in the morning, and they poor fellows leave at 12 in the noon, because for 8 hours they're standing in the line. If their number comes, they get the OPD slip. If the number doesn't come, they will wait for another day. Now, what we are doing is we are basically having a scan and share. If you have your ABHA, which is the health account number, you can just scan the QR code and register yourself digitally without any contact. And these are small conveniences which we are trying to create for the people. We are doing it in the Lady Harding's hospitals. It last about 2 weeks, and we will scale it up to other AIMS and other hospitals. So these are, basically you have to provide a value proposition to the people to start using digital technologies, and that's what we are attempting at this point in time.
So Dr. Sharma, this is great. When you look at the individual doctors and small hospitals, large hospitals have been investing for some time in digital technologies. How do we incentivize them to move on to this? They have to write prescriptions, they have to upload data, and so on. Is there a way we at CAHO can help you? But what is your dream in terms of how we can get everybody on board?
Excellent, Mr. Mittal. You have always, been hitting on the basic issue. This is a wonderful question I should have dealt with. What we have done is we have done two things. One is that we are basically, large hospitals can buy HMIS, health management information system, which can manage your, OPD, which can manage your laundry, which can manage your beds and other kinds of things. A small doctor, maybe a husband-wife clinic or maybe a small hospital, they cannot afford to buy such HMIS system. They cannot afford to buy, basically there are many constraints. Money is least of them, maybe technology, awareness and other kinds of things. So what we are doing is we are, incentivizing basic tech players to create what is called low-cost HMIS on a subscription basis. So like this, that there are many HMIS systems now available, which are being offered at the rate of 500 rupees per month, which includes the entire, storage of records and other kinds of things also. 500 rupees is, you guys buy a Netflix subscription or something like that. And this will be as easy as creating an email account. So basically what you do, you just create your basic account where you provide the basic details of your hospitals and other things. So that's what is you are able to, create and store these records. That's number one. Number two, there are now technologies available. We actually had a hackathon, and there are technologies available where you just sit in front of your, this machine, the computer or a laptop or whatever, and you just speak. And the digital prescriptions are prepared. So essentially, how the idea is that the doctors, they should not reduce their productivity by using digital. They should increase their productivity by using digital. So how we can make it easy for them to interface with the machine? We are also repurposing COVID to essentially provide for a universal immunization program. We are also thinking that the repurposed COVID could be used to create such email type of accounts, and we could offer this service free of cost to maybe one doctor, individual doctor who is basically just wanting to go digital, become digital. So that's the kind of thing which is being taken from the supply side to ensure that people are able to. And I'm sure CAHO can help us. We can have a offline discussion on this issue. We'll be very happy to basically, you can try a pilot in some place whereby you can take this as a project that we will digitize the entire thing. And then you can come out with the basic issues as to what are the problems in digitization, how the doctors find it difficult, whether they are finding it difficult or finding it easy. And there are AI and ML solutions available. So if I put a system in front of a Dr. X and that Dr. X prescribe paracetamol, this, that, all kinds of medicines. I'm not a doctor. I'm one of those doctor of philosophy, not really a doctor of medicine. But what I'm saying is that, if you prescribe, then this system learns individual doctor, like the iPad type of thing. The Siri learns your intonation, your pronunciation. Similarly, this system will learn, and then it will basically make it easy. Even that writing systems are also coming now, where you just write. Some doctors' writing is the most difficult thing to understand. But once they explain that this A stands for anosine, then next time he writes the same A, the computer will understand this is anosine. So that way it can happen. So interaction of the doctor with the machine can be made more easy by using the artificial intelligence and other technology means.
This is amazing. Just before we let you go, this is an amazing large project that you are at. What is it that you lose your sleep on where we will come and help you?
Well, I don't want to share that with you because believe me, the technology providers, these companies, I don't want to name them. These companies, while we imagine solutions and we have very clearly articulate things, these guys sometimes, don't really deliver. And then what happens, the engine which is running, it stops, and then the states start calling me saying that this is not working. And then I really not only lose my sleep, I lose my temper too.
Right. Dr. Sharma, I'm going to request Dr. Agarwal to comment on behalf of CAHO as to how we're going to work with you. Dr. Agarwal, are you there?
I think this has been a wonderful talk, sir. Very excited to kind of learn from you the state and the scale at which things are developing. And I think the last part of the discussion where you talked about a solution which can be provided to the small and medium hospitals is, I think, going to be the game changer. And I think we'll personally come and interact with you to see how we can try to take that as you take it on your proposal, to take it as a pilot basis in some parts of the country, to see that what are the roadblocks in that kind of a solution. So thank you very much. And I think it was a wonderful experience, sir.
Sharmaji, God bless you. Keep the good work you're doing, and we are with you. Thank you very much, sir.
Very much, Mr. Mittal, Mr. Agarwal. And please do come over sometime to, think of ideas of working together. Thank you very much.
Thank you.